this is Miss Roberts. We're going to be going over Chapter 18, which is caring for the child with an immunological or infectious condition. It starts on page 591 in your book. So, moving on to 592, talks about the anatomy, of course, of the immunological immune system. If you remember, antigens are what? They're our foreign invaders, and then our antibodies are our fighters, okay? So antigens are our enemies, antibodies are our armies, okay? Just make sure you remember the difference in those. All right, let's look on page 595. Let's talk about HIV and AIDS. So human immunodeficiency virus, HIV, destroys the helper T cells, T4, CD4, destroying the immunity of that cell, okay? There are things that you need to know, and of course you see this picture has a wink and a lollipop, right? So there are 4 interventions in HIV positive school-aged child who is malnourished. Number 1, you need to be assessing their oral cavity every shift. They get the oral thrush, the candidias, so you need to be assessing that. Number 2, determine their food preferences. They're not going to want to eat. So if they want to eat French fries and chicken nuggets, let them eat French fries and chicken nuggets. Anything is better than nothing, okay? You need to encourage adequate oral intake. Make sure they're staying hydrated, they're drinking enough, okay? And then you need to be providing oral hygiene after each meal. Get that bacteria out of their mouth, and rinsing their mouth, brushing their teeth. A lot of them will have the antifungal mouthwashes, okay? Some signs and symptoms are chronic diarrhea, malabsorption, of course, failure to thrive, the oral thrush. So be familiar with these right here, okay? And an infant, you need to read through that, okay? There are some tests that we do for antibody testing. This is on page 596 underneath the assessment tools. This is some winks and lollipops, okay? Make sure you know this information. So we have the ELISA test. This is an enzyme length immunosorbent assay test, okay? It identifies the presence of HIV antibodies. If it is positive, it merits repeating. And if it's still positive, then we need to add the Western blot test that confirms that fluorescent antibody test, okay? It confirms those antibodies. So, you do the ELISA. If it's positive, you repeat the ELISA. If it's still positive, then you do the Western blot test. Winks and lollipops, okay? You need to be checking for non-compliance in an HIV patient that is not responding to retroviral medications. That's on a sticky note in my book. So check for non-compliance for any HIV patient that's not responding to retroviral medications. Okay. In your book on page 597, there's some more information. They are children that are HIV positive are affected by malnutrition, okay? They'll experience the malnutrition, the diarrhea, adverse GI effects, so make sure you understand that. And a lot of that is because of the HIV treatments, okay? Healthy choices, we just talked about that. Making sure they're eating healthy. They're eating it all, but just hopefully they'll eat healthy. emphasize the oral care. Make sure that they are knowledgeable, or their parents are knowledgeable about vaccines, okay? It's very, very important. Their immune system is already low, so we want to make sure that they don't pick up anything else. Make sure they are getting their vaccinations, okay? All right, lupus on page 599. Systemic lupus erythematosus, SLE, is a multi-system chronic immune disorder, okay? It affects the blood vessels and connective tissue. There's some comorbidities over here listed on this chart. Lots of joint pain, anemia, heart disease, thyroid disease, pleuritis, kidney disease, rashes, photosensitivity, osteoporosis, lots of eye problems. It's a really a bad thing. Lots of triggers can include estrogen levels. So I have a friend right now that is pretty much diagnosed with lupus because she is perimenopausal. So her estrogen levels are kind of triggered that lupus, okay? Some signs and symptoms: fever, malaise, chills, weight loss, fatigue. All right, let's talk about anaphylaxis on page 602. So, of course, you know this is a medical emergency, right? This is the IgE and the non-IgE activities that cause life-threatening an event. So, shock. Of course, our airway closes. The histamine can shorten the diastole, causing vasospasms. But it is increased vascular permeability that causes the laryngeal edema, closing the airway. Okay, very important to know. Winks and lollipops. Okay, so it is again the increased vascular permeability that causes the laryngeal edema, closing the airway. Winks and lollipops. Some signs and symptoms, of course, will be the wheezing, the facial edema, swollen tongue, nasal congestion, laryngeal spasm, vascular collapse, cardiac arrest. It can happen at any time for any reason. Somebody that knows that they are allergic to something like peanuts or bees or something that's very common, they usually carry an EpiPen with them. So make sure that you're teaching the parents how to use the EpiPen, even teaching the children how to use the EpiPen, okay? They need to know how to act quickly. 604, medical care. So basic life support, of course, airway, breathing, circulation is so important, all right? So ABCs, don't forget your ABCs. And then don't forget about the epinephrine, the EpiPen, okay? Infectious diseases of childhood. Let's talk about that on page 605. So there's two different types of periods that I want you to learn. Some winks and lollipops. Is the incubation period and the communicable period, okay? So winks and lollipops, you need to know what is the incubation period. That's when the organism is invading the body and the symptoms start, okay? So that's when it starts invading, kind of incubation. And then communicable period is when the child is contagious, okay? They can transmit that pathogen to others, all right? So just be familiar with those terms, winks and lollipops, okay? And this is sepsis and fever, which are, of course, signs and symptoms of infectious diseases. Community associated MRSA, methicillin-resistant Staphylococcus aureus, scarlet fever, just some different things that we're going to talk about. Diphtheria, pertussis, whooping cough, tetanus, measles, mumps, rubella, and varicella, which is chickenpox. So let's look at page 607. This starts the different types of diseases. So chickenpox is a viral thing, right? This is known as varicella. Diphtheria is bacterial. And then you have rubella, which is the German measles. Influenza type B. Influenza type A. Then you have pertussis, which is mumps there too. But on page 611 is back up and find it. Pertussis is bacterial, and it's known as the what? The whooping cough. Okay, winks and lollipops. You need to know it's called the whooping cough. Okay. On page 615 is a really good explanation of the pathophysiology of a fever. I want you to make sure you read that. It's very, very good. The book did a good job in describing that and what actually happens with a fever. Okay. Viral infections on page 616. We're going to talk about fifth disease, erythema infectiosum. Pregnant women cannot be around anybody with fifth disease, okay? It can cause a fatal death, okay? It can cause stillborn, miscarriage, it can cause fatality for that fetus, okay? So they do not have any antibodies, and they acquire this from a child, and they can lose their child, okay? It's a parvovirus, so it's a human parvovirus. Cytomegalo infections on page 617. It's herpes family, okay? So it's important for you to know that you cannot be around any infants, newborns, with anything like this, okay? As nurses, as anybody. Some babies born with CMV are asymptomatic, but some can experience hearing loss. So it's very traumatic. Herpes simplex on page 618. Extremely common. You have herpes simplex 1 and you have herpes simplex 2. Okay, herpes simplex 1 is on your mouth, lips, facial lesions. If you have a cold sore, fever blister, you cannot go to clinical on OB peds because they are very contagious and our babies can get herpes on the brain. So we cannot go to clinical if you have a fever blister. You need to be letting me know. I've had to miss clinical because I've had one before. But how did I get HSV1? So somebody, when I was an infant, obviously kissed me with a fever blister or touched me with a fever blister after they wiped their face or something. That's how I got it. That's how anybody gets it. Now herpes simplex 2, just because you have herpes simplex 1 does not mean you have herpes simplex 2. But you can get herpes simplex 2 from herpes simplex 1, okay? So if you have an active lesion, you need to be teaching your patients. If you have an active lesion on your face, you cannot have any type of oral sex because you can give your partner herpes simplex 2, and that is the genital lesions. Okay. If mothers have active genital lesions when they are in labor, they cannot deliver vaginally because the neonatal, the fetus, the baby, when they're born, can go through the birth and it can become herpes on the brain. So prevention, of course, is transmitted through saliva, and they would have to have C-section. Okay. (619) talking about Epstein-Barr virus. This is mono, okay? Very, very contagious. This is our kissing disease, okay? First discovered through kissing, okay? It's pharyngitis, swollen lymph nodes, hepatitis, enlarged spleen. So make sure you understand that, what that is. 7 to 10 days is our active phase. And usually kids cannot go back to school until their spleen is of normal size. Okay? Fungal infections. So Candida albicans, which is our oral thrush that we talked about a while ago with our HIV patients. Anytime, it's not just HIV, anytime that our PEDS patients or babies or anybody's using antibiotics or steroids, they are prone to having the Candida albicans, the fungal infection. It's very common. Okay. Nursing care for this is a swish and swallow medication. All right. They need to administer this medication in a dropper for infants, but older children can just swish and swallow because we want to cover the entire oral field down to the stomach. Okay, you can get something called stomatitis, which is like the Candida albicans from your mouth all the way down your esophagus into your stomach lining, and it's truly just like the thrush, the rash all in your mouth, all down. So it's fine for them to swish and swallow that medication, wink and lollipop. Okay. And there's a picture of this Candida albicans here, the oral thrush. And then we have Tinea capitis, which is a ringworm of the scalp. You see that here? It's not an actual worm. It is a fungal infection. Okay? It will cause hair loss in that area until it's healed. Then we have something called Tinea pedis, which is athlete's foot. Okay? Their feet almost look like a plastic cover is over them. Very itchy, very uncomfortable. They start peeling. They need to change their shoes often, using some antifungal powders. Especially our teens in the summertime. Tell them, change your socks 2 or 3 times a day if they're outside. Our football players, any athletes, band members, football players, whoever, somebody that's wearing shoes all day, make sure that they know to change those socks often. They need to be wearing sandals and shower shoes in public showers because this fungus lives there. They like wet spots, right? And then we have Tinea curis, and this is our jock itch. Okay, it can happen in the armpits, it can happen in the growing area, diaper rashes even. So be familiar with that. Animal-borne infections, okay, and this is a picture of that, the ringworm. These are, before I move on to the animal-borne, these are rashes that look like ringworms, so psoriasis, discoid eczema hives, Lyme disease, that's our bullseye rash, lupus even, pityriasis rosea, contact dermatitis, granuloma annulare. So, all right, animal-borne. So let's talk about rabies real quick. This affects the nervous system, central nervous system, and can affect the brain and death. So very, very serious. They need to be informed. Anytime they're bitten by an animal, raccoons walking up to them like they're friendly, they're probably rabid, okay? So be aware. Educate your patients. On page 623 again is cat scratch fever. They have Bartonella, which is infection through the cat's saliva. Bartonella henselae. It causes blisters around that site and some lymph node enlargement, okay? It can last for months. It can affect the axillary nodes, the epitrochlear nodes near the elbow. So just make sure you read on that. And this is the rabies here. Affects that central nervous system. And then the cat scratch, you see how it swollen lymph nodes here and how it blisters up on the side. I want you to look on page 627. It's got the vaccines, so you need to be reviewing those vaccines again, okay? Make sure you understand. I know you're studying, you've studied them in the last module, but you need to be reviewing those, okay? Varicella. When is varicella given the first time? Age 12 months or older, right? So make sure you know that, varicella. The first dose is at 12 months. All right, that is it for Chapter 18 and Module 7A.